Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Levetiracetam. Its brand name is Keppra. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video, as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how levetiracetam works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe levetiracetam. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. How does levetiracetam work? Well, it inhibits burst firing without affecting normal neuronal excitability. It may selectively prevent hypersynchronization of epileptiform, burst firing, and propagation of seizure activity. In terms of indications or reasons we would prescribe this medication to a patient, we can see it used as an adjunct therapy in partial seizure, myoclonic seizure, or primary generalized tonic-clonic seizure. With respect to contraindications or reasons we would not be able to prescribe levetiracetam, we wouldn't give it to a patient who had a hypersensitivity to levetiracetam or any other component of the formulation. Now what about dosing with levetiracetam? So when used as an adjunct therapy in the treatment of a myoclonic seizure, the initial dose would typically be 500 milligrams given intravenously or orally twice daily. The patient may increase the dose in increments of 1,000 milligrams per day every 2 weeks up to a maximum dose of 3,000 milligrams per day. When it's used as an adjunct therapy in partial seizure, using the extended release formulation, the initial dose would be 1,000 milligrams orally once daily. The patient may increase the dose in this situation in increments of 1,000 milligrams per day every 2 weeks, again to a maximum of 3,000 milligrams per day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using levetiracetam, so I'll go over some of those here now. 13% of patients may develop an infectious disease, while 3 to 8% may experience loss of appetite. Vomiting may occur in 15% of patients, and some patients may experience a decreased bone mineral density. 2 to 8% may experience neck pain, and 15% may experience asthenia or abnormal weakness. Dizziness may occur 5 to 9% of the time, and a headache may occur 14 to 19% of the time. 7 to 38% of patients may experience abnormal behavior, and 6 to 12% may experience irritability. 2 to 9 may experience a cough, and nasopharyngitis may happen 7 to 15% of the time. 10% of patients may experience fatigue. Some more rare but serious side effects would be Stevens-Johnson syndrome, toxic epidermal necrolysis, or angioedema. That's all we're going to talk about today with levetiracetam or Keppra. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check it as well. That's it for today. Take care.